Good morning, everyone. My unique ID is S1329, and topic for my poster presentation is photobiomodulation in prosthodontics. Laser stands for light amplification and stimulated emission radiation. It was invented in the year 1967 by Mr. Andre Master, and laser can be classified as hard tissue laser and soft tissue lasers. These classification is not according to the type of tissue exposed, but according to the laser tissue interaction. Triple LT, which is low level laser therapy, falls into the category of soft tissue laser. The properties of laser light that is different from the non-laser light is that it is monochromatic in nature, which is a light of a single wavelength. Two beams of light are coherent when the phase difference between their waves is constant, which is the property of laser light. A collimated beam of light that has parallel rays will spread minimally as it propagates. Coming on to the mechanism of action for laser light, the photoreceptor molecules of mitochondria, on which laser radiation seems to act as a photostimulant, can trigger a series of photochemical reactions, which in turn causes changes in the cellular metabolism, such as protein signaling. The key photoreceptor is cytochrome oxidase. In the presence of NADPH, nitric oxide is generated in the mitochondria of cells. And in oxygen deficient conditions, this results in lifting of the respiratory interference and the flow of oxygen is restored. Low level laser therapy mainly conducts in red to near infrared region of wavelength. For soft tissues like epidermis and dermis, the wavelength is up to 400 to 700 nanometers, and for muscle and bone, it is up to 800 to 900 nanometers. Coming on to the prosthodontic clinical applications, the main application is for the implant therapy. Triple LT can effectively decrease pain and sensation during and after the implant placement. It can be given in 6 sessions during the day of implant and after 24 to 48 hours. For TMJ and orofacial pain, from simple to acute cases like facial pain, laser therapy will reduce pain and inflammation and significantly resolve trismus. It softens the overly tense and hard muscles by increasing circulation, causing muscles to relax and normalize intramuscular pressure. 60 milliwatt of laser light is given for 7 days. It can also be used for pre-prosthetic applications like aphthous and traumatic ulcers and oral mucositis. It readies the oral cavities for the prosthesis. For nausea and gagging, application of laser at acupuncture point of wrist will decrease gagging defect by many patients. During impressions and x-rays especially, it calms the parasympathetic nervous system. In case of dental infection, the laser can be applied to increase the lymphatic flow of infected area, to reduce the inflammatory cells and bring the neutrophils to the site of infection for faster healing. Laser safety is a main concern. A laser safety officer must be always present in the assigned area.